Hello, everyone. Welcome. On this week's episode on What Pharmacists Do, we have a very special guest, my very own little sister, not my sister from another mother or from another father. This is Tatiana, Tati, as we call her at home. She's my sister, my one and only baby sister. And she is currently, she went to pharmacy school, the same school as me, Touro University, California. She graduated in 2020, the pandemic class. And since then, she's been working at Kimal Medical Center in Hoopa, California. Welcome, Tatiana. Welcome. Glad to have you here with us.
Thank you.
I would like to start by asking you my favorite question. What do you like best about being a pharmacist?
I think what I like the best about being a pharmacist is kind of being that last, phase between like me and the patient. The patient goes and see the physician, and the physician sends me a prescription, and I review it, and then it goes to the patient. I kind of like to be that last line. Even just yesterday, I was working and the patient was prescribed Bactrim for a UTI. And, even though we always have the allergy record of the patient, has to ask every time, what allergies do you have, if you have any allergies. And she told me she was allergic to sulfur. And I asked her next question always, what kind of allergy reaction did you have? And she says, swollen tongue, difficulty breathing. So I told her right away, you cannot have this medication. And I also asked her when is the last time she had such a reaction, and she said it was about 2 years ago. It's like, yes, you cannot have this medication. So, I just ran to the doctor's office because it's right just ran to the doctor's office and told her, you prescribed this for this patient, but she's allergic to sulfur. Can we try microblading? It's like, sure. And just took a verbal right there about a prescription. And if it was the end of the day, just fill it and give it to her, And she was very grateful that I did all that for her, So that's those are the moments that I really appreciate as a pharmacist.
Yeah. So your favorite part is pretty much being the security guard of the prescriptions. You're guarding it, you're guarding the patient, you're having the patient's back. And because you're the last step in the prescription dispensing process, you're able to catch any omissions or errors, and things like that.
Yes.
Awesome. So, sis, tell us about Hoopa and Kimal Medical Center and Eden Health Service. What would you want us to know about it?
So for most people don't really know where Hoopa is. So Hoopa is in northern California. So I'm talking about passing Sacramento, passing Redding. Passing Redding, and you get to it's around Eureka. So I live in Hoopa, which is I live in Hoopa with the Hoopa tribe, which is a Native American tribe, Hoopa tribe. And I work at the Kimal Medical Center there, which is Indian Health Services Center. The Indian Health Service, for people that don't know, the Indian Health Service, or IHS, it's a federal health program for American Indians and Alaska Native. So their mission is to elevate the health of Native Americans, just to provide the best healthcare and all the services as well for them, just to elevate their health.
Got it. So it's a federal program in charge of promoting the health of Native Americans, what we call our Indian Americans. And what do you do what kind of pharmacy setting is it? And what do you do for your patients there?
Yes. So I work in a medical center. It's an outpatient setting. I work in the outpatient pharmacy there. We receive prescription from the physicians that work there. And we also have a dental service. So we also receive prescription from the dental office there. It's an outpatient setting. So as you can imagine, verify prescription, get prescription, verify them, discuss with the provider if I have any if I need to make any changes to be made, I can just call the doctors right there and then discuss it with them. provide consultation to my patients. We also have a diabetes program, diabetes classes, where we teach diabetes patient about using the insulin, measuring the blood glucose, diet. We have a kitchen there, so we kind of show them what they can eat and what they shouldn't eat, and what type of exercise, the difference between diabetes, like type 1 and type 2, and just the little difference, so they have a better understanding of the disease state. Something that I'm very proud of is we have a pain committee there. The opioid crisis is very it's a very big problem in that in Hoopa. It's a very big
patient population.
In that patient population. So we have I'm part of the pain committee that we have every week or every other week, where we work. It's an interdisciplinary program where we work with physicians. We discuss about if a physician has a patient that they deem is a difficult patient in terms of the opioid use or opioid demand. That's when we discuss if the patient should be on opioid, if that's what they know, if they need to be on any opioid medication, if that's even what they need, and if they do, we want to make sure that it's used properly and it's for the right amount of time there. So, and as a pharmacy, we have been actually able to decrease the number of opioid medication used there by a lot. So that's something that we're very proud of. I know the opioid crisis is very big, and in America in general. So that's something that we really try to reduce, because everywhere you can hear of somebody dying of overdose. So that's something that's very a big problem in Hoopa.
Okay, got it. So to recap, it's a pharmacy that's within the medical center, and the medical center is the only medical center available to the Hoopa tribe, and that's where they come and get their care. And of course, when a provider sees a patient and deems that a prescription is necessary for the patient to help with the condition, the prescription gets submitted to you in the pharmacy, and you have access to the patient's electronic health record. You know pretty much everything you need to know health-wise about the patient to assess the appropriateness, safety, and efficacy of the order you're receiving. And you are in the great position to interact and communicate with the doctor and discuss improvements and changes in terms of how to improve the patient care. You are involved in diabetes education, lifestyle education to decrease the rate of diabetes in that patient population, or improve the blood sugars. You talked about the pain committee, and you are right. Being in the middle of a big opioid epidemic, we have a lot of deaths from overdose, from prescription opioids or prescription misuse. And I'm so happy. I was clapping when you talked about drastically decreasing the use of opioids and the adverse effects that come with it in that specific patient population. And I'm sure to know that you reduced or by how much you reduced this these incidents, you had to also go back and collect data and analyze the data and publish that data. And that's what pharmacists do. Thank you for coming on and telling us about this area of pharmacy that many people don't know. I personally didn't know until I got into pharmacy school and heard about a scholarship from the Indian Health Service, and they have great residency programs. They have great clinical pharmacy program, and they serve a great. The mission is amazing for the patient population that they serve. So thank you, sister, for coming on and talking to us about this. And I hope to have you on more episodes going forward. And I don't know if you know this, you are one of the reasons I started the Ricky Pharmacist, because I went through pharmacy school before you. And when you were prepping for pharmacy school, where you were in pharmacy school and looking for a job and stuff, you were always coming to me and asking questions. And along with you, there were other
That's
friends.
true.
There were other friends that were
That's
also
true.
contacting me about the interest in pharmacy school, and it just got me thinking, hey, I can do this for everyone, especially our Cameroonian people, our immigrant
I know.
folks, or who don't really know how the system works in this country. So just being, just walking with you through that process, I thought I could walk other people through the same process.
Yeah.
So guys, if you have any questions about becoming a pharmacist, about being a pharmacist at Indian Health Services, you can reach out to me on my Instagram page, The Rookie Pharmacist. My website is therookiePharmacist.com, and I can answer any questions you have, get you in touch with Tatiana if you have any questions for her. And until next time, have a great week. God bless you. I love you. Bye-bye.
Bye-bye.